at least one or two waveforms, it's okay. You don't need to get the whole spectrum. Even if you get one waveform where you can identify the waveform very well, you can understand the flow very well, that should be good, right? So again, I take my RI over here, intrarenal RI is important, and your acceleration time. That is, of course, you can look at the index as well. I am more used to looking at the acceleration time. This is what? Okay, yeah. So I'm getting acceleration time. Sorry? PI is no, we don't use PI for categorizing it. So again, I have acceleration time of 47, which is very good, right? So a couple of things that you need to remember is when you're looking at intrarenal flow, it is the RI and your acceleration time which is important. When you're looking at the main renal vessels, your RI and your acceleration time have no value. Okay, all you want to look at is your peak systolic velocity. Right, so after that is done, now I try to move on to my renal artery. Now, one of the best ways to identify the renal artery is actually you try and go transhepatic, right? Transhepatic or subhepatic. So what the problem which happens over here is you have the IVC, right? So the IVC and the renal vein. So your artery goes behind that, the right renal artery. So it's a little difficult to identify the origin. Okay, Ashwin, take a deep breath. Okay, so I'm trying to go a little bit behind. It's not working out as of now. Relax. If you have a thin vein patient, sometimes you may want to evaluate the artery even in a B mode. You may pick up plaques even on the B mode over here. Okay, now I'm trying to identify. I think this should be the origin over here if I'm not mistaken. थोड़ा लंबा सांस लेके Okay, so now I've started seeing my renal artery. So now I'm trying to angulate in such a way that I see it originating off the aorta. Relax, breathe normal, normal breathing, normal breathing. Normal breathing. So now I've got the orientation of my artery. Now I'm just trying to get a better image. Can you see this? This is the renal vein, and this is the renal artery, and this is the aorta. So I'm trying to identify the point at which it's coming off the aorta, because this is what is very important in terms of getting a good, this is where majority of your stenosis is going to happen, right? Okay, and again. थोड़ा सांस थोड़ा Okay, I am kind of gotten it. Okay, relax, breathe normally. So this is actually the site at which it's originating. The aorta is here. This is the origin. I am trying to get a slightly better one if I can. थोड़ा सांस. Yeah, relax. Okay, that's the site, right? So that is the site. So you can see that this is the aorta over here. This is the origin coming off over here. This is the renal artery. So in fact, in him, I would have expected it to be much more easier, to get the images than what it's turning out to be. So you always have to be ready for surprises. Now the other advantage of getting this view is that you can get good velocities as well. You can try and make the origin of the artery incident to your beam. What I'm doing is I'm trying to give the angulation first. Not that it makes too much of a difference. This is where it's originating, and I'm trying to identify it. Okay, so this is relax. So this is the direction. This is the direction in which the artery is going, and this is where the origin is. That is why my angulation is in this fashion. Right, so again, the only thing I'm interested in over here is the PSV. PSV looks to be good. Right, I'm trying to see if I can get a slightly better image. I would have expected very easy images coming in there, but it's not the case. थोड़ा लंबा सांस. Okay, I'm not getting very great images, but anyway, so that is how, yeah, again, see, that is your renal artery position over here, right? So that is how you try and do your renal Doppler. Again, once you've identified the origin, like I said, always try and identify the entire vessel also, right? So I'm trying to see that. So in fact, I'm getting a good chunk of the vessel. Yeah, I think now I'm getting a little better image. Can you see this now?
Yes.
I'm trying to increase the. So in fact, in him, I can see the vessel much more nicely on the green mode. Somehow the color, I don't know, is kind of betraying me, but a little deeper. Okay, but I hope all of you got a bit, yeah, perfect. Relax. Okay, so this is the almost the entire length of your renal artery, right? So this is your aorta, your origin coming up over here, your mid segment, and your hiatus. So if you have any kind of narrowings coming up over here, you should be able to identify that as well, right? Yeah. So I think I've covered up whatever in renal artery.